There are four main types of prosthetic devices for the upper limb. The four types of devices are passive, body-powered, myo-electric, and hybrid. Let's get started by taking a deeper dive into passive devices. Passive devices can be either static or positional. A static device lacks any movement at all, while positional devices can be manually placed into various positions. Passive devices are often referred to as cosmetic devices, but these names should not be used interchangeably. Typically, when people refer to a cosmetic device, they are usually referring to a device that is visually appealing and/or lifelike. The term restorative is a better term to use for these types of devices, as they aim to restore a sense of normalcy by providing a more naturalistic appearance. A device can be non-restorative as well, meaning the goal is to simply have a device that works like a passive limb, but does not have the goal of restoring a more naturalistic appearance. An example of a passive restorative device is pictured on the left. As you can see, it has a very naturalistic appearance. Some patients may opt for a device that blends in, while others may want something that has a more technological appearance. Others may be indifferent. It's important to consider functionality as well as the patient's preference on the physical attributes of a device. An example of a non-restorative device is on the right. It has a very simple design and is primarily used for opposition and assisting in bimanual tasks. Both restorative and non-restorative devices have their place, so it's important to consult with the patient and the prosthetist on what best fits the patient's needs and goals for prosthesis use. Passive positional devices are passive devices that are bendable or spring-loaded. They provide a little more function than static devices by allowing the user to manually place a device into various positions and grip patterns. They are also known as ratcheting devices because they ratchet into place, as you can see in the video on the left. Though passive positional devices are a lower tech option, they can be very functional. Various tools like utensils and grooming objects can be placed between the fingers and used to assist in activities of daily living. Overall, passive devices tend to be lightweight and require minimal to no harnessing. Though passive devices do not have any active grasp capability, they can help with stabilizing objects, carrying items, and assisting in other bimanual tasks. Next, we will discuss body-powered devices. A body-powered device is the most commonly prescribed upper limb prosthesis, and it's a lighter weight option. Body-powered devices are controlled by compensatory motion of the residual limb, both shoulder joints, and the spine, primarily by the intact limb or side. These devices may require more involved systems of suspension, also known as the way that the device stays on the residual limb. A harness with cable system attached operates the device. Gross motor body movements are performed to increase the distance between two parts of the body and operate components. This is known as excursion. Each component requires various levels of excursion to open or close. A body-powered device is more intuitive for users. The cable-driven system increases physiological proprioception and allows the individual to receive direct feedback. A challenge of a body-powered prosthesis is that the user may have difficulty sustaining grip, operating the terminal device overhead, or reaching behind their back. Depending on the level of amputation, some individuals may experience difficulty generating the necessary force to operate the device. Also, some body-powered approaches to harnessing can cause discomfort on the contralateral side, compressing the axilla, and are potentially leading to nerve damage over time. Next, we will talk about myo-electric devices. A myo-electric device may be a good option for those with full digit or proximal limb loss, and it's a more high-tech option than a body-powered device. Externally powered devices reduce the strength and range of motion needed to operate. Electrodes are placed on the skin over the muscle belly to detect electrical spikes created from a muscle contraction. Then, the electrodes will read the signal and transfer it to the prosthesis in order to create movement. Myo-electrics have their own tier system of complexity. Some myo-electric devices simply allow for the opening and closing of a 3-jaw chuck pinch pattern. This is also called a basic myo device. As the cost and complexity increase, a multi-articulating hand becomes an option. Multi-articulating means the myo-electric device can perform multiple grip patterns and imitate movement similar to a normal human hand. Finally, as the price and complexity continue to increase, we see the more high-tech multi-articulating hands available. A myo-electric device can be self-suspended, decreasing the need for a harness. This device is appropriate for a user who wants more physiological control, increased grip strength, and a more technological appearance. Since a myo-electric device uses muscle activity from two antagonist muscle contractions in order to operate movement, this device does have more of a learning curve compared to other prosthesis options. Myo-electric devices can also be heavier, louder, and a little more temperamental than other options available. The last type of upper limb prostheses that we will discuss today are hybrids. A hybrid device involves both myo-electric and body-powered components, meaning grip might be controlled by the myo-electric portion, while the elbow joint is cable-driven. The hybrid option is typically available for individuals who have had an elbow disarticulation or more proximal level of amputation. A hybrid is the happy medium between body-powered devices and myo-electric devices. This option is ideal for someone who wants something a little more high-tech, but also something that's still lighter than a pure myo-electric device. Hybrids will provide a little more physiological control and grip strength than a body-powered device can offer as well. However, a hybrid device still has the same challenges as a myo-electric device. They're usually louder and potentially more temperamental. Which device has no active grasp capability, but can be positioned into a static 3-jaw chuck grasp if needed? Is it the passive positional device, the myo-electric device, or a passive static device? The correct answer is a passive positional device. A passive positional device can be manually placed into various positions, including a static 3-jaw chuck grasp if needed. Remember, these devices are also known as ratcheting devices because they can be ratcheted into certain positions. A myo-electric device would be incorrect because it does have active grasp capability. A passive static device would also be incorrect because it's static, which means it has no movement ability. A passive static device is mostly used to assist in opposition and other bimanual tasks. Which device is typically the most lightweight prosthesis option? Is it a passive device, a myo-electric device, a body-powered device, or a hybrid device? The correct answer is a passive device. Body-powered would be next, then hybrid, then a myo-electric device would be the heaviest option available. Which device typically has the most grip strength? Is it a passive device, a myo-electric device, a body-powered device, or a hybrid? The correct answer would be a myo-electric device. A myo-electric device has the most grip strength, followed by a hybrid device, body-powered, and then passive. Which device uses a cable-driven system? Is it passive, body-powered, or myo-electric? The answer is a body-powered device. A body-powered device is a cable-driven system that is attached to a harness that allows for suspension and operation of the device. Which device may present difficulty sustaining grip, operating the terminal device overhead, or reaching behind one's back? Is it a passive, myo-electric, body-powered, or hybrid device? The correct answer is a body-powered device. Now, I do not have any limb loss, so this is not fitted correctly, but this is more just to give you a demonstration on what the difficulties and challenges are when you're working with a body-powered device. Remember that body-powered devices are controlled by compensatory motion of the residual limb, the shoulder joints, and the spine to create excursion and operate the terminal device. So you can imagine how it would be difficult to sustain grip, reach overhead, or reach behind one's back to engage in different activities. Which device may operate one joint with myo-electric control and another joint with body-powered control? Is it a passive device, a myo-electric device, a body-powered device, or a hybrid? The correct answer is a hybrid device. A hybrid device combines both myo-electric and body-powered components. Let's reflect now on everything we talked about in this video from an OT lens. How can the type of device a patient has impact the following? Psychosocial health, range of motion, quality of life, skin integrity of the residual limb, ease of use, pain, engagement in ADLs, and someone's return to work. Also take some time to think about how a patient's client factors can impact prosthesis use and either prevent abandonment or cause abandonment. Reflect on the values, beliefs, and spirituality of a person. Think about their body structure, their motor skills, their body functions, their process skills, and also their social interaction skills. How do all of these play a role in how successful a patient is or isn't with the prosthesis?